Alhamdulillah, sallallahu alaihi wasallam. Good afternoon, distinguished guests and fellow professionals. Today I'll be shedding light on the pressing issue of psychosocial aspects in spine care, transcending beyond physical health. Neck and back pain are leading causes of disability worldwide. In 2020, over 600 million individuals globally suffered from low back pain, and the projection of these cases is set to rise dramatically, with estimated suggesting more than 800 million people could be affected by 2050. In Saudi Arabia, prevalence rates ranges from 64% to 89%, with chronic cases reported in 34% of the population. These figures represent not just physical pain, but also psychosocial distress, strain, and social isolation. Demographically, the prevalence of back and neck pain peaks in midlife, often correlating with career and family stressors. In Saudi Arabia, occupational factors like job specialty and long working hours contribute to this also. Notably, women frequently report higher incidence of back pain, possibly reflecting gender-specific roles and stress. This leads us to the spine-mind gap, and outdated concepts where physical and psychological aspects of pain were viewed separately. Modern healthcare advocates for a holistic, interdisciplinary biopsychosocial approach, recognizing the interplay between the spine and the mind, and emphasizing the need for integrated care. Let's consider patients with chronic back pain. Two individuals with similar MRI finding might experience vastly different pain levels. This disparity is shaped by emotions, mental strain, and social context, highlighting the need for a holistic approach in treatment. Transitioning to a more specific context, we explore a pivotal study from Riyadh by Al-Huwaimil et al., examining the psychosocial impact of MRI diagnoses in patients with chronic low back pain. This research sheds the light on how diagnostic outcomes transcend clinical boundaries, deeply influencing patient daily lives. This study involved 11 individuals with chronic low back pain, aged between 27 and 61, who lacked clear medical diagnosis. Through their experiences, 4 critical themes emerge from this qualitative research. Psychological impact. So participants reported increased anxiety, fear, and depression after undergoing the diagnostic imaging, contributing to avoidant behaviors and a reduction in physical activity. Also, social participation. So the MRI diagnosis often led to patients withdrawing from social and family engagement, signifying a marked impact on their everyday social interactions. Also, conflicting messages and diagnoses from doctors, trying to explain this MRI findings. And the last theme was patient education. So the study highlighted varied educational approaches by healthcare professionals, from detailed pathoanatomical explanation to a broader psychosocial advice. These insights from Riyadh accentuate the profound effect that medical diagnoses, particularly through MRI, have on psychosocial well-being of patients. It's a reminder of the need for a comprehensive treatment approach that addresses physical as well as emotional and social aspects of chronic low back pain. This study also reinforces the critical role of the holistic biopsychosocial model in spine care, emphasizing the necessity of understanding and addressing the intertwined physical and psychosocial facets of our patient's condition. As we've seen from the Riyadh study, the psychological and social impacts of a spine condition are significant. Studies continuously show a significant association between chronic pain and psychological distress. This underscores the necessity of incorporating psychological therapies into chronic pain management, focusing on the patient as a whole. To further underscore this point, let's consider key findings from an important review paper titled "The Role of Psychosocial Process in the Development and Maintenance of Chronic Pain." This review highlights how psychological factors, such as emotional distress, coping strategies, and individual perception significantly contribute to the development and persistence of chronic pain. It reinforces the idea that our psychological makeup and social environment play a crucial role in how we experience and manage pain. The paper also emphasizes the variability in pain perception and the effectiveness of psychological intervention like cognitive behavioral therapy in managing chronic pain. The recent COVID-19 pandemic has intensified these psychosocial challenges. A study examining patients with chronic pain during the early phase of social distancing in Massachusetts found significant increase in pain severity and interference compared to before the pandemic. This highlights how social isolation can exacerbate chronic pain conditions. Demographic and psychosocial factors such as gender, race, education, and disability status, along with pain catastrophizing, emerge as strong predictors of increased pain severity. This suggests a compound impact of social restriction on vulnerable populations. Such insights are critical as we consider the ongoing psychosocial stresses our patients may face and reinforce the need for resilient, adaptable, and personalized care strategized during times of widespread social disruption. This aligns with the broader view we've been discussing of treating not just the physical symptoms, but the whole person in their specific psychosocial context. Chronic pain often leads to a domino effect of reduced activity, disrupted sleep, social isolation, and increased stress, creating a cycle that exacerbates the condition. Addressing these psychosocial elements is crucial in spine care. This illustrating the complex intertwined relationship between chronic pain and psychosocial factors, demonstrating the bidirectional influence and the need for a multifaceted treatment approaches. As we reflect on these insights, I invite you all to consider how can we further integrate this holistic perspective into our daily life, or reflected on our daily practice, and how can we better understand and support the unique psychosocial needs of our patients with spine conditions. We could consider incorporating regular psychosocial assessment into patient evaluation, fostering interdisciplinary collaboration, and continuously educating ourselves about psychosocial aspects of chronic pain management. In conclusion, as Hippocrates wisely said, it's more important to know what sort of person has a disease than to know what sort of disease a person has. This philosophy is central to our approach in spine care. I urge you to embrace this holistic perspective in your practice. Thank you for your attention, and I look forward for potential collaboration for advanced